Patients use CPAP and BiLevel machines to support their breathing and sleep better. BiLevel is also known as BiPAP, or more commonly by the trade name BiPAP. To understand how CPAP and BiPAP therapies work, it helps to understand what happens during normal breathing. When you inhale, your diaphragm flattens, causing your chest and lungs to expand. This movement pulls air into your lungs through negative pressure. Oxygen in the air is then exchanged for carbon dioxide and other waste gases in your blood. This exchange happens in the small air sacs of your lung called alveoli. As you exhale, your diaphragm relaxes, which pushes air back out of your lungs. Unlike normal breathing, CPAP and BiPAP therapies use positive airway pressure, or PAP, to push air into the patient's airway and lungs. If a person's airway becomes too relaxed, especially at night, it can become floppy or even partially collapse. This makes breathing difficult and causes a condition called obstructive sleep apnea. This disorder obstructs breathing and can disrupt sleep by waking the person, sometimes hundreds of times a night, to take a breath. Constant waking causes fatigue, diminished focus, mood swings, and daytime tiredness. It can also cause long-term problems, including a weakened immune system, diabetes, acid reflux, and heart complications. Continuous positive airway pressure, or CPAP, treats obstructive sleep apnea by delivering a continuous pressure of air. This keeps the patient's airway open, making it easier to breathe and stay asleep. CPAP machines keep the airway open, but CPAP cannot assist with breathing. If the patient needs help breathing, they require a BiPAP machine. BiPAP machines deliver two pressures. One assists with inspiration, and the other holds the patient's airway open after exhalation. The two pressures are IPAP and EPAP. IPAP, or inspiratory positive airway pressure, is the higher pressure and assists with inspiration. EPAP, or expiratory positive airway pressure, is the lower pressure and remains in the airway after exhalation. EPAP and CPAP both provide continuous positive pressure to hold the airway open. The names, however, differ based on whether the patient is using CPAP or BiPAP therapy. BiPAP machines are used for more serious conditions. These include neuromuscular and degenerative diseases, where the patient is unable to generate an adequate breath on their own. Central apnea, where the brain fails to signal the patient to take a breath. And acute breathing issues, such as pneumonia. Because many BiPAP patients cannot take a deep breath, they are at greater risk of alveolar collapse, known as atelectasis. This is a serious problem. EPAP, along with keeping the airway open, may prevent atelectasis. CPAP and BiPAP pressures are measured in centimeters of water and are prescribed by a physician. Patients using CPAP generally have prescriptions with only one pressure setting. An example of a prescription is CPAP of 5 centimeters of water at night. Patients using BiPAP have two prescribed pressure settings, IPAP and EPAP. An example of a BiPAP prescription is IPAP of 12 centimeters of water and EPAP of 6 centimeters of water, or BiPAP of 12/6. The prescription may also include a breath rate and inspiratory time, or I time, which is the amount of time the IPAP is delivered. There are also auto-adjusting CPAP and BiPAP machines. Instead of static pressures, these machines can be programmed with a range of pressures. For example, a patient with an auto-adjusting CPAP machine may have a prescription for a CPAP range of 4 to 8 centimeters of water. The auto-adjusting CPAP machine adjusts within that range to find the best pressure to keep the patient's airway open. Auto-adjusting BiPAP machines can also be programmed to automatically adjust during therapy to best ventilate the patient. Respiratory clinicians set up CPAP and BiPAP systems for patients based on their prescription and may program additional settings based on patient needs.